If you've ever been in the hospital, you may have seen a smaller bag of fluid hanging above your main IV bag. It might seem unassuming, but that little bag is called an IV piggyback, and it plays a crucial role in many medical treatments. Today, we're diving into the world of IV piggybacks, what they are, why they're used, and how they work.
In simple terms, an IV piggyback is like a mini IV bag containing medication that gets administered through your primary IV line. It gets its name because it literally piggybacks on the main IV. This method is often used to deliver antibiotics, pain medications, or other drugs that need to be administered slowly and in a controlled dose.
Let's talk about the mechanics. There are two main ways to administer an IV piggyback. 1. Gravity drip. Here's where the name piggyback makes perfect sense. The piggyback bag hangs higher than the main IV bag, using gravity to infuse the medication. This method provides a gentle and steady flow. 2. Eye pump. Hospitals often use eye pumps for precise control over the medication's flow rate. Nurses can program the pump, ensuring accurate dosage and timing. No height adjustments needed.
Safety is paramount when it comes to IV medications. Not all medications are compatible with each other. If two incompatible medications mix, it can create problems like a precipitate forming or the drugs losing effectiveness. To avoid this, nurses flush the IV tubing between different IV piggybacks or, depending on hospital policies, use separate lines for each medication. This reduces the risk of harmful interactions.
Here's a cool fact. You don't always need a continuous IV drip for a piggyback. Some patients have what's called a saline lock, a capped IV catheter in their vein. This gives nurses quick access for periodic medication infusions. Between infusions, nurses flush the saline lock with normal saline to keep it clear and prevent any leftover medicine from causing issues.
Let's get to the heart of the matter. Why do doctors and nurses use IV piggybacks? There are several reasons. Controlled delivery. Piggybacks are fantastic for administering medications on a set schedule or precise dosage that needs to be delivered slowly. Versatility. Whether a patient needs pain medication alongside antibiotics or hydration coupled with another drug, the piggyback system provides flexibility. Efficiency. It simplifies the process of delivering multiple medications.
Setting up an IV piggyback is always done by trained medical professionals, usually nurses or doctors. Some hospitals even have specialized teams. First, the doctor determines the medications needed. Nurses then double, check the medication's dosage, and ensure there are no harmful interactions. Then, they carefully connect the piggyback line, program the IV pump if used, and ensure everything flows smoothly.
While IV piggybacks are generally safe, it's important to be aware of the potential risks, mainly associated with equipment errors and human factors. These can include concurrent flow. This happens when medications intended for separate infusions end up mixing or get administered at the wrong times due to incorrect IV setup. Connection mistakes, errors in how the bags are connected, can also lead to medications mixing unintentionally. Valve problems. Issues with the valves controlling medication flow could prevent the medicine from reaching the patient or result in an incorrect dosage. These risks underscore why it's crucial to have trained medical professionals handling IV piggybacks.
An IV piggyback isn't a permanent fixture. It stays on only as long as needed for the medication to be completely infused. This can vary depending on the drug and the dosage. Once empty, a nurse will safely remove it. If further medication is needed, they can easily attach a new piggyback.
If you're a patient and need an IV piggyback, it's natural to have questions or even a little anxiety. Don't hesitate to ask your healthcare team about the following. What's in the bag? Get to know the medication you'll be receiving and why it's given in this manner. How long will it take? Have a clear understanding of how long the infusion will last. What should I expect? Ask if there are side effects or any sensations you might experience. Open communication makes the whole process less intimidating.
So, there you have it. IV piggybacks demystified. While the concept may seem complicated at first, it's actually a clever and efficient way to deliver necessary medications in a hospital setting. If you ever find yourself needing an IV piggyback, remember, your healthcare team is there to guide you through the process and answer your questions. Thanks for watching. If you found this video helpful, give it a thumbs up and don't forget to subscribe for more informative health content. Feel free to leave a comment if you have any further questions about medications.